Hello everyone, I am Dr. Vibhash Vaidya and today in this video we are going to discuss about the cervical vertebra. So in the human body, 7 cervical vertebrae is present, out of which first, second and seventh are atypical because their features are different, and 3 to 6 are typical because their features are same. So today in this video we only discuss about the typical and first cervical vertebra. So let's see in the detail. You can see here, this is a typical cervical vertebra and the body of the typical cervical vertebra is small and transfer diameter of the body of the typical cervical vertebra is bigger than the anterior posterior diameter. The superior surface of the body, which is concave transversely with the upper projecting lip on the each side. You can see here a upper projecting lip which present on the each side. Then the inferior surface of the body, which is saddle shaped, being convex from side to side, and anterior posteriorly it is concave. The lateral border are beveled and form the synovial joint with the projecting lip of the next lower vertebra. You can see here the lateral border which is beveled, and the anterior border project downward and may hide the intervertebral disc. Then the anterior and posterior surface, you can see here this is the anterior surface of the body and here this is the posterior surface of the body. Then the vertebral foramen, you can see here a triangular large foramen. This foramen is called the vertebral foramen. The vertebral foramen is large than the body. It is triangular in shape because the pedicles are directed backward and laterally. Here you can see this is the pedicle, and this pedicle which connect the body with this appendages, and this pedicle are directed backward and laterally. The superior, you can see here this is the superior articular notch, and inferiorly this is the inferior articular notch, and this superior and inferior articular notch are equal in size. Then the lamina, here this is called the lamina, and the lamina relatively long and narrow, being thinner above than the below. Here the upper edge of the lamina is thin and lower edge is thick. Then the superior and inferior articular process, here this is the superior articular process and below this is the inferior articular process, and this superior and inferior articular process forms the articular pillar which project laterally at the junction of the pedicle and the lamina. The superior articular fasciae are flat. You can see here this is the superior articular fasciae which is flat and they are directed backward and upward. Then the inferior articular fasciae, this is the inferior articular fasciae and it is are also flat but are directed forward and downward. So this is the superior articular fasciae and here this is the inferior articular fasciae. Now the transfer process, you can see here this is the transverse process, and this transfer process appears by a foramen over here, and this foramen is called foramen transversalia, and each transfer process has anterior root and posterior root which end in a tubercle joined by the costotransverse bar. This is the costotransverse bar. The costal element represented by the anterior root or anterior tubercle. This is the costal element which represent the anterior root or anterior tubercle. While the costotransverse bar, this bar which represent the posterior tubercle. This is the posterior tubercle. Then the spine. You can see here this is the spine of the typical cervical vertebra, and this spine is short and bifid. You can observe here the spine of the typical cervical vertebra is short and bifid, and over here you can observe a notch, and this notch is filled by the ligamentum nuchae. Then we'll discuss about the attachment of the typical cervical vertebra. First, the anterior and posterior longitudinal ligament. You can see here upper and lower border of the anterior surface of the body. Here we have attachment of the anterior longitudinal ligament, and same manner the upper and lower border of the posterior surface of the body. Here we have attachment of the posterior longitudinal ligament. Now on the east side of the anterior longitudinal ligament the vertical part of the longus colli is attached to the anterior surface. Now on the posterior surface here has two or more foramina for passage for basivertebral vein. Now you can see here the upper border of the lower part of the anterior surface of the lamina, which provide attachment to the ligamenta flava. Then the foramen transversarium transmit the vertebral artery, the vertebral vein, and the branch from the inferior cervical ganglion. The anterior tubercle here. This anterior tubercle which give origin to the scalenus anterior and the longus capitis and the oblique part of the longus colli muscle, and costotransverse bar. This bar are grouped by the anterior primary rami of the corresponding cervical nerves. Then the posterior tubercle here, which give origin to the scalenus medius, scalenus posterior, and levator scapulae muscles. Then the spine, and this spine give origin to the deep muscle of the back of the neck, infraspinal, semi-spinal thoracis, and cervicis spinalis, cervicis, and multifidus muscle. These are muscles which attach over the spinous process. So this is all about the typical cervical vertebra. Let's see the first cervical vertebra. This is the first cervical vertebra and it is called the Atlas. The Atlas is a Greek titan who support the heaven. It is ring shaped and it has neither a body or nor a spine. The Atlas has short anterior arch. You can see here. This is the anterior arch which is short, and long posterior arch, and the right and left masses, and the transverse process. You can see here, this is the transverse process. The anterior arch is marked by a median anterior tubercle over here. This is the median anterior tubercle on the anterior arch. The posterior surface bears a oval facet. You can see here the posterior surface of the anterior arch which bear a oval facet, and this oval facet which articulate with the dens of the second cervical vertebra. Then the posterior arch here. This is the posterior arch, and this posterior arch forms 2/5 of the ring, and it is much longer than the anterior arch. Its posterior surface, this is the posterior surface of the posterior arch, and it is marked by the median posterior tubercle over here. This is the median posterior tubercle. The upper surface of the posterior arch, here you can see a groove, and it is marked by a groove. Then the lateral mass. This is the lateral mass of the first cervical vertebra, and its upper surface bear a superior articular facet. This is the superior articular surface which present the upper surface of the lateral mass, and this facet is elongated forward and medially. You can see here this facet which is elongated forward and medially, and it is concave and it is directed upward and medially, and this facet which is directed upward and medially, and it articulate with the corresponding condyle to the form the atlanto-occipital joint. Then the lower surface here this is the lower surface, and this lower surface marked by an inferior articular facet. You can see here the lower surface of the lateral mass which marked by a inferior articular facet, and this facet nearly circular or more or less flat, and it is directed downward and medially. It is directed downward and medially and backward, and this inferior articular facet which articulate with the corresponding facet on the axis vertebra to form the atlantoaxial joint. Then the medial surface here. This is the medial surface of the lateral mass, and this medial surface which marked a small rough tubercle. Here you can see a small rough tubercle which present on the medial surface of the lateral mass on the each side here. Then the transverse process. Here this is called the transverse process of the first cervical vertebra, and this transverse process which project laterally form the lateral mass. It is unusually long and can be felt on the surface of the neck between the angle of the mandible and the mastoid process. Its long length allow it to act an effective layer of rotatory movement of the head. The transfer process is pierced by a foramen. You can see here on the both side, this transfer process is pierced by a foramen, and this foramen is called the foramen transversarium. Now the attachment. Over this anterior tubercle, we have attachment of the anterior longitudinal ligament, and on the each side of this anterior tubercle, we have an attachment of the upper oblique part of the longus colli muscle. Then the upper border of the anterior arch here, and this upper border of the anterior arch, which gives attachment to the anterior atlanto-occipital membrane. Then the lower border of the anterior arch here, and this lower border of the anterior arch, which provide attachment of the lateral fiber of the anterior longitudinal ligament. Then the posterior tubercle here, and this posterior tubercle, which provide attachments to the ligamentum nuchae in the median plane and give origin to the rectus capitis posterior minor on the each side. So this posterior median tubercle, which provide attachment of the ligamentum nuchae, and on the each side we have attachment of the rectus capitis posterior minor. Then you can see here a groove, and this groove occupied by the ventral artery and by the first cervical nerve, and behind the groove, the upper border of the posterior arch give attachment to the posterior atlanto-occipital membrane. So this groove, which occupied with the ventral artery and first cervical nerve, and behind this groove we have attachment of the posterior fiber of the atlanto-occipital membrane. Then the lower border of the posterior arch here, this is the lower border of the posterior arch, and this lower border of the posterior arch, which give attachment to the highest pair of the ligamentum flava. Then the tubercle on the lateral masses over here, this is the tubercle which is present on the medial surface of the lateral masses. Over here we have an attachment of the transverse ligament of the atlas. So this tubercle which provide attachment of the transverse ligament of the atlas. Then the anterior surface of the lateral masses, over here we have attachment of the rectus capitis anterior muscle. Then the rectus capitis lateralis, which attach over the upper part of the anterior surface of the anterior arch. Then superior oblique muscle, which attach over the upper part of the posterior surface of the anterior arch. Then the inferior oblique muscle, which attach over the lower part of the tip of the anterior arch, and levator scapulae from the lateral margin. Over here we have a attachment of the levator scapulae, and the splenius cervicis and scalenus medius, which attach over the posterior tubercle of the transverse process. So here we have attachment of the splenius cervicis and scalenus medius muscle. So this is all about the attachment of the first cervical vertebrae. So this is all about the typical and first cervical vertebra. I hope all of you understood the topic. Thank you for watching.